My mum, she's 93. She is a very caring person. If someone's sick, she's always checking on them. She loves to knit. She loves to have a chat.
She loved coffee, so she was always brunching out, you know, eggs Benedict and coffee. She just craved being social, and she just loved people. She was such a people person.
These are the faces of some of the people who died in one of the country's deadliest coronavirus outbreaks.
My initial thought was that would never happen at Newmarch House. To be fair, there was no major initial concerns. I thought of all the homes, it wouldn't be Newmarch. And it bloody was. I still can't believe it. Of all the homes.
Over almost 6 weeks, 19 elderly people died after COVID-19 raged through their nursing home.
They're sitting there waiting to die. They're prompting to not move them to hospital. How are they going to survive? Just sit there and get worse. Get them out. It's a no-brainer for any normal Australian.
They definitely wanted it contained at Newmarch. They didn't want it anywhere out of there. They wanted whatever was going to happen to stay at Newmarch and be contained and not have any spread anywhere else in the community.
Tonight on Four Corners, we investigate how our most vulnerable were exposed to the deadly virus, how authorities wanted the disease contained rather than risk it spreading out into the community, and why families want answers from those in charge.
Shocking. It's a nightmare. It's been terrible for us. You know, we don't even know what's going on. Mum's got dementia. We don't know exactly what's happening. They never tell us anything if she's got the virus or not.
We wanted to know if the staff had brought it in, why weren't they getting heat sensor tested? They're doing it at the airports, they're doing it at hospitals. Why weren't they doing it here?
It's late April and a group of families have gathered outside Newmarch House nursing home in Sydney's west. They're struggling to find out what's happening to their relatives who are locked inside the facility.
Len's room's just over there. We're thinking about getting a ladder and just climbing the fence and running up to her room, you know, and just talking to her, you know, just through the window.
The families say they have no idea what's going on inside because no one's answering their phone calls. So they've taken the extraordinary step of holding a public protest outside.
Why have you come down here today to join the other families?
We need answers badly, straight away, not today. We want it today, not tomorrow. You know, we need something done today, not tomorrow. We can't wait till tomorrow. You know, it's just ridiculous. We need something to happen soon.
We complain so often, we ring them up and they won't answer the phone calls. Today, they just don't answer. And then they turn around and say, oh, no, we've been busy. He says, well, put extra staff on so you can answer us, because we can't get any information any other way.
It's been 12 days since the first coronavirus infection was detected. Now, 29 elderly residents and 15 staff are infected. 4 of the elderly are dead.
They can't cope, it's impossible.
Families have been told they're not allowed to visit, and residents won't be allowed to leave.
I haven't actually had a chance to speak to Mum directly for about 2.5, 3 weeks, I think, now. You know, and yeah, that's it. I just, you know, you get told, oh, she's off for food, but is that because she can't manage herself?
Yes.
And she's not being helped, you know, as she should be, or what, you know? So yeah, that side of it's really upsetting.
We have a Facebook page and it's for family and friends of Newmarch House residents. So please hop on there and ask to join in, and then we can get information out to each other and share things that are really important.
Brett Doble is worried about his 81-year-old mother Jan, who has been sick with the coronavirus for 10 days.
And how did you find out that she had the virus?
She actually put herself in. She was feeling crook and she went to them and they tested her. And then they rang my sister because she's the first contact. And she rang me.
Has she seen anybody today?
Only first thing this morning. They took a temperature because she had fever during the night, so yeah.
Is she able to buzz and get people to come?
Yeah, they don't come, but she'll buzz and it'll be up to 2 hours before someone comes. It's shocking.
Even though she's got coronavirus?
Yeah. That's what I mean. They're just sort of just left there, left in their room, you know, fend for yourself.
Brett says he can't get in touch with anyone from Newmarch House. With dozens of regular staff having to self-isolate, Brett's worried his mother is missing out on basic care. He rings his mum to find out what's going on.
Have you seen anybody today?
Only the nurses. I haven't seen any doctors or anything.
No.
Brett, I'm still over the moon to think I had a shower.
Yeah, I know. It must have
2.5 weeks without a shower or washing my hair. When they came to me this morning and said, you can have a shower.
Yeah.
Oh, the greatest thing I'd ever heard.
Yeah. What'd you have for lunch?
Peanut butter sandwich.
Okay. Is that all there was? Is that what you asked for?
I had to because they didn't bring me lunch to me. And they said, what do you want, 2 slices of bread?
Yeah.
I said, okay.
But is that all that was on offer?
Yeah,
Did you get
I had some peanut butter here. I haven't seen a soul, Brett. You're just locked in your room and you don't see anyone.
As the purpose of this meeting, I'll actually...
That night, Anglicare Sydney's CEO Grant Millard hosts a webinar to explain to families how he's struggling to find replacement staff.
That's the reality of this challenge. Even with the resources and many providers being put forward, getting that staff in there who know what they're doing, who are guaranteed to turn up, that is a day-by-day challenge. We've reached out to not only our own agency suppliers, but 8 aged care agencies who do supply staff. We've gone to local hospitals, private hospitals, seeking to get more staff, and it has been a monumental challenge.
Anglicare has started bringing in more registered nurses, but the bulk of the staff are low-paid personal care workers.
There's no minimum requirement mandated for care workers in the industry, so there can be people who have no training at all or who have done an online aged care so-called course who can be available to work in the facility. Now, some of those people, when you're desperate, as you may have been at Newmarch House in that particular situation, and you're just accessing anybody, but you're most likely making the situation worse because you can be the best-hearted person, best-intentioned person in the world, but when you don't know what you're doing, dealing with something as extraordinary as coronavirus can be very difficult.
The following day, the relatives return to Newmarch House. 2 more residents and 2 more staff members test positive. And a 96-year-old woman dies, taking the death toll to 5.
Multiple health issues.
Aside from the coronavirus, families are worried about the level of care, saying the home still doesn't have enough staff.
It's the thought of her being left all day in a room, yes, in the bed with nobody looking in on her. It's just...
And it's a fear of the unknown. Because you're not getting the information, you can't guarantee that that's not happening.
No, that's exactly right. They, like you say, they admitted last night how understaffed they've been.
My mum's Patricia Shea, she's 76. She was one of the initial people that tested positive.
Anthony Bowe says his mother isn't receiving meals on time and staff don't answer her buzzer, recently waiting 2 hours for someone to find her after a fall.
Early on, it was just understaffing. They were grossly understaffed and the nurses were obviously having to prioritise. And lately, I don't think there's any excuse now. I mean, they're behind a door, so they have to assume that every time that buzzer goes off, it's an emergency because they have to rule that out. 2 hours is just not acceptable.
So, you've got some news. What's happened? Mary Watson has just learned her mother, Alice Bacon, is one of the 4 people who tested positive today.
My mum tested positive this morning. They got the results through at midnight last night. That's her 4th test. First 3 were negative, so we sort of thought she was fine. She was out of the woods. She's been trapped in her room all this time. She found out that there was a problem when she hadn't received her medication in the morning, early morning, and at 10:15 she stuck her head out the door and saw the sign on the door. So she rang.
Sorry, the sign on the door said?
It just said something about wearing, gowning up. You know, it was a caution for the staff. But I had to tell my mum that she was positive because she was so distressed about what was happening outside, because she's a good girl and she stayed behind that door and she had no knowledge of what was happening on the outside. And then all of a sudden the outside came and hit her in the face. So she was extremely... And thinking that she's done something wrong to get the virus. But I haven't left my room. How could I get it? How could I get it? Yeah. My mum's 93 and sharp as a tack. I'm actually wishing she had a little bit of dementia at the moment so she didn't know the reality of what's happening. But she knows she's now got the virus. She's been watching the news. She knows it's the elderly who are passing away with secondary complications, which she has got. So we're just trying to get her to stay positive and just, breathe through this, yeah.
Newmarch House wasn't the first aged care home to be hit by COVID-19. In March, the virus struck a Sydney Baptist care home, Dorothy Henderson Lodge. The alarm was raised when a staff member tested positive.
I found out about the outbreak via a text message. When you get that kind of news, a lot of different thoughts are running through your head. I was kind of wondering if, okay, I'd seen her a couple of weeks earlier. Was that the last time I get to see her? Are you just in bed or what's happening?
Tom Wright's 68-year-old mother, Christine, is a resident at Dorothy Henderson Lodge.
I went to 3 cases, then it went to 5 cases, 10 cases, and, that was fairly regular. You'd be sort of just minding your own business and your phone would ring and suddenly there's another case.
Over a month, 16 residents and 5 staff contracted the virus. The vast majority, 80% of the residents who tested positive were sent to hospital. 6 of them died.
It was a small outbreak and there was a swift response, and the local state government was able to offer assistance. The public health unit was able to step in. That assistance was accepted, and then people were able to contain and manage the outbreak quickly.
The last death at Dorothy Henderson Lodge was April 6. 5 days later, the first infection was detected at Newmarch House. A staff member had worked 6 shifts at the home while infected.
I received a call on Easter Sunday to say that a resident and a staff member had tested positive. So I just remember my heart just sank because I'd felt that Mum was in the safest place in Australia.
Louise Payne's mother was amongst the first diagnosed.
Mum's name is Yvonne Vane and she went to Newmarch in December of 2017 and she's been living quite happily there. She made friends, chatting to people each day, wandering, did lots and lots of walking, and on the 14th of April, sadly, she was diagnosed with coronavirus. We couldn't get any information and talk to anybody. So you could go 6 hours before you found something out. The angst was dreadful, and it just went on and on and on for days. And I know, they're saying, oh, well, we were tending to patients, and I don't doubt that that's exactly what they were doing. But surely it was obvious that they were in trouble and they needed to put their hand up and say help. And I don't know that they did.
Another resident of Newmarch House was 76-year-old Anne Fay. She moved in 2.5 years ago.
Nan decided to make the move to Newmarch House.
Nan, you want the beers?
Purely because she absolutely craved that social interaction. She loved having a cup of coffee with friends, and she was a very socially outgoing person. She had a lot of friends.
Yeah, go Nan.
From the start of the outbreak, Nicole Fay says her grandmother kept to her room. Anne Fay was tested 4 times, each test negative. But she didn't cope with the lockdown.
She did not step foot out of that room. I do remember her saying, all I do every day is long for that door to open and to see a face. And that's when it really started to sink in that those residents are not in a good place. There's a virus that's rampant in the home and we can't get them out. And in the meantime, their mental health is declining.
Some families were desperate to get their relatives out. But New South Wales Health was determined to keep residents inside Newmarch House. One family wanted to remove their relative, a man in his 90s who was testing negative, writing to Anglicare saying, "Our biggest fear is that he's still bunkered down in the premises where this outbreak has and is continuing to spread on a daily basis." Anglicare replied that New South Wales Health had instructed them that no resident may leave the home. This is to reduce and contain the risk of spread. I understand as a public health order, it may be legally enforceable. New South Wales Health confirmed it could create an order to prevent the resident from leaving, saying the elderly man would face fines of $11,000 or 6 months imprisonment if he were to breach it.
They definitely wanted it contained at Newmarch. They didn't want it anywhere out of there. They wanted whatever was going to happen to stay at Newmarch and be contained and not have any spread anywhere else in the community.
The man later contracted the virus and died shortly after.
There definitely should be the option to get them out. If a family has the facility and want to change their life to help their loved ones survive, get them out. Anyone who wants to leave that premises should be able to leave. It's their life. They have a right to survive. They have a right to have a fighting chance and get the best level of care. At the moment, the best level of care is not in that house. They're totally at risk.
Instead of being sent to hospital, the vast majority of residents who tested positive were treated under a program called Hospital in the Home. This approach was initiated by New South Wales Health and backed by Anglicare, the federal government and the Regulator, the Aged Care Quality and Safety Commission.
So those treatments that we're using are exactly the same whether the patient is in hospital in the home, outside of an aged care facility, the same as in an aged care facility, and exactly the same, by the way, with what we do on a patient who's admitted to hospital.
At the time, I just felt, no, that'd be right. They'll be able to do everything because that's what I was told, that they would be able to do everything a hospital would do except for ventilate. I assumed if she needed an X-ray, then she'd get an X-ray. If she needed a blood test, it'd be done on the spot. A urine test, it wouldn't take 2 or 3 days to find out what was going on. And that wasn't the case, sadly.
The current aged care staffing profile does not allow the nurses and care workers working in the facilities to run a hospital in the home, even if they all had the right skills. For some years, we've heard a range of things, particularly from our nurse members. Two different things, that facilities won't provide the equipment that's needed to provide some higher level care, clinical care, so they didn't access the people equipped, well trained enough to actually, and they weren't transparent and clear, and it wasn't coordinated well.
It's now 17 days since the first infection was detected at Newmarch House. Despite the highly contagious virus, the positive and the negative residents haven't been separated and continue to live in rooms side by side. There are 54 cases, 34 of them residents. 7 people are dead. Families gather and discuss the 2 latest deaths.
Your mum's a little bit better. What about the other first round? How are they going?
I don't know.
Because my mum's the second round, and the gentleman that passed during the night was only diagnosed on Friday as well.
I know, so 3 days. And no connection with the doctor.
Frozen sandwiches for lunch again for my mum. She's cold, she can't reach her blanket. She's doing her washing in the bathroom sink. It's just horrific. It's just, I don't want that to be the last time I see my mum. I want to be able to walk up and wave at the window, at least. I think that would help their mental. Yeah. Just to be able to see us and know that we're out here. Where do I look? Emails.
Minutes later, an email comes through from Anglicare.
So they're deeply saddened to advise of another 4 residents of Newmarch House have tested positive.
Oh, 4 residents.
Yeah. Have passed away since yesterday. Oh, sorry, my voice is going up because I can't believe what I'm reading. 4 have passed away since yesterday evening. And the families have been contacted, and of course they express their deepest sympathy for those residents with a positive diagnosis. So, words fail me.
That night, Mary Watson and her husband Jeff tune into a webinar organised by Anglicare.
Well, good evening, everyone, and thanks for giving us your time and joining us.
They're frustrated when they realise no one from Anglicare is there to answer questions.
It's just not good enough. People are dying in there. We're not being informed. We don't know what's going on. The care is compromised. I know the staff in there are doing their best, but there's something wrong.
After 90 minutes, Mary and Jeff have had enough.
They need to act. They need to act quick. Not, we'll look into this. They need to act tomorrow. They've got to. I mean, we've got days. They get sick so fast. The virus gets hold of them so quick. Look at that poor lady there. Negative, then positive, and then it's gone. If the ones that are positive and they're contained, they're isolated, how are others getting affected?
Now, Grant Millard is the CEO of Anglicare Sydney, and he joins us now.
The next day, the CEO appears on TV to offer his sympathies to families.
To see them dying so quickly in these circumstances, despite the best medical care and attention that's being given to them, and with the full staffing we have on board now, it's still a situation of significant grief and trauma. At the end of the day, we are just one humble nursing home trying to look after people who we love and care for, and this is stretching everybody.
18 days after the outbreak began, there are 56 infections, 22 staff and 34 residents. 12 people are dead.
So I come this morning and it wasn't up, so...
After weeks of negative media attention, Anglicare has erected a barrier.
The only thing it's achieving is stopping me seeing my mum. So that's just another heartless piece of crap. The same from day one. Just disgusting. Corporate response, not a humanitarian response.
Anglicare also organises so-called window therapy, allowing families to see their loved ones up close through the glass.
I was so excited when I got the call. Thank you, Anglicare. It was just amazing to see her. I'm just trying not to cry.
It's like winning the lottery.
Oh.
Just, it was so easy to organise. We've been asking for this for 2 weeks, I believe.
We talk about their twilight years, but really it's become their twilight days, and they're stuck in there. And, it's not anyone's fault. It's the virus that's got in there. That's the enemy. And the elderly are the target for COVID-19.
The next day, Anne Faye is found on the floor of her room with a fever. She's tested for COVID-19.
About 2 o'clock in the afternoon, we still hadn't actually heard about the test result. So Dad's gone to try and call back someone else, and he's accidentally hit the number of the nurse that called that morning. And Dad said, "Oh, look, sorry, I've accidentally called you. But while I've got you, how's my mum going? How's Anne Faye?" And she responds with, "Oh, sorry, haven't they called you yet?" And he said, "No, what do you mean?" And she said, "Oh, Anne's positive. I'm not dealing with Anne anymore." And that's all we got. So we didn't even get a phone call as soon as she was positive after being found on the floor. You would think you would prioritise that. I know those staff were trying to do their best, but somewhere along the line, it just wasn't good enough. It just wasn't good enough. How can someone who had not left their room for weeks and weeks, not leave a room and have that virus enter when she was originally in the ward that didn't have the virus? It's staff. It's poor infection control. It's poor knowledge on how to use the equipment.
They say they were told Anne had a 40% chance of surviving and that she would be made comfortable at Newmarch House rather than go to hospital.
It sounded like a response that he had said multiple times. It sounded like a pre-written script, and I was not standing for a pre-written script for my 76-year-old perfect nan. I was not going to take on board that advice because it was absolutely absurd. He did then go on to talk about an advanced care plan, which, to anyone, if someone's talking about an advanced care plan, they've already made up their mind on what's going to happen with this scenario. And for the record, all the papers that Nan signed for her advanced care plan was, in other words, "I'm 76, you bloody keep me alive."
Nicole Faye inundated the media with her story, and early the next morning, Anne Faye was transferred to Nepean Hospital. The family was shocked by the contrast in conditions.
The infection control at the ICU unit, what I saw in comparison to that home in that room, it's a total different world. That kind of level of infection control should have been present at Newmarch, and if that wasn't able to be facilitated at Newmarch, get them out. Why weren't they at the hospital? Why weren't they all in those ICU rooms? Give them a chance.
Within hours of her admission, Anne Faye was dying.
Her lungs were completely ravaged and damaged by COVID to the point where they weren't working either. And we just all stood there and we literally couldn't believe how fast that happened. And she was actually gone. She was having coffees and brunch like a few weeks before. She can't even have a coffee, and that was really hard. And I think it's just forever. It's just going to be those little reminders. But, like I said, any death is horrible. Any family has to grieve. But I think with the poor communication that we had over the last month, There has to be an inquiry. This has to be looked into because it shouldn't have happened.
We're looking at secondary cases and we've clearly seen transmission that on the surface looks like there's been breaches in infection control amongst particularly the staff.
Finally, New South Wales Health makes the decision to separate positive and negative residents. From now on, staff will also be tested every day. It's been 3 weeks since the outbreak first began here at Newmarch House and the infection continues to spread. New South Wales Health has now launched an investigation because they believe some staff haven't been using the personal protective equipment properly. And now families are concerned that those staff may have unwittingly infected their loved ones with COVID-19. Days later, and with 16 people dead, the regulator steps in. The Aged Care Quality and Safety Commissioner Janet Anderson threatens to sanction Newmarch House because of the immediate and severe risk to the health, safety and well-being of residents unless it appoints an independent advisor recommended by her. The advisor is a former investment banker, has no clinical experience and has worked in aged care for just over 2 years. In a statement, Commissioner Anderson said he has the knowledge, skills and experience for the job.
The approval of the appointment by the regulator is just yet another symptom of the sector. The regulator themselves doesn't appear to understand what's fully required when you're in the midst of a global pandemic that's threatening people's health. What you need is a health response. You need a health expert, not a financial expert.
Oh, it's my mum.
Mary Watson is increasingly worried about how her mother Alice is faring after being diagnosed with coronavirus.
Hello?
It's been 6 weeks since she's even been able to hold her hand.
You feeling a bit better?
Yes.
You don't look so good.
No, I'm all right. Stop worrying about me.
Well, of course I'm going to worry about you.
Who was it earlier? When I came in, who was on the phone with you?
Oh, that was Peter at the Bible study.
Yeah.
So you're having lots of phone calls?
No.
Are you still very cold?
Yes.
Yeah. You all right?
Okay. Yes.
Okay. You be good.
Okay, and Daniel's all right?
Yes. Yes, Daniel's fine. Don't worry about him.
All right.
Okay. Love you.
Right. Love you.
Talk soon.
Oh God, she looks terrible.
Does she?
We've been told at the start, expect 50% to pass. That's the round figure, and we're up to 15. So yeah, I just don't want my mum to be one of the 20. I know that's terrible for all the other families, but it's my mum. So.
3 weeks after testing positive, Alice Bacon's health is deteriorating.
My mum became very dehydrated. She was ordered fluids, IV fluids, but they didn't have them there, and it was the next afternoon before they were put in and started.
The week before. Oh, no.
Mary Watson is allowed in to visit to comfort her mother. A relative outside her window captures her distress at being locked inside.
What's wrong with her? Yeah?
It was distressing for all of us to watch her like that. She just kept yelling, "Get me out of here, get me out of here," screaming, holding my hand so tight, squeezing it, yelling at us to get her out of there. Then towards the end, she just sort of threw her hands up in the air and just said, "Get." Like we failed her a little bit, I think. Yeah, it was horrific.
Mary Watson's mother Alice died 3 days later, the 19th person to die at Newmarch House and Australia's 100th victim from COVID-19.
Hello, Mary.
Good morning. Come in.
Thank you. My sincere condolences to you about your mum.
It's hard.
That wasn't what you expected, was it?
No, not at all. The more time passes, the more time we reflect on the actual things that were happening, the more questions that are coming to our head, like about the treatment, and yeah, it's just been a terrible journey, terrible journey.
It wasn't our mum anymore. She, had this battle and couldn't get over it. And she didn't want to die. Not from COVID.
Mary Watson now believes that the virus kept spreading because of infection control breaches.
Well, there has to have been. Otherwise, we wouldn't have been looking at the terrible statistics. I don't believe for a minute that the infection in the residents or in the staff occurred from that one person initially. There had to be cross-infection across the way.
After Louise Payne's mother Yvonne tested negative, her daughter insisted she go to hospital because she said she'd lost 8 kilos and was still on oxygen. It turned out she had undiagnosed pneumonia.
Once they got the IV antibiotics into her to treat the pneumonia, she's starting to pick up. It's amazing how much she has picked up since going to hospital. Incredible, actually, incredible. I'm shocked. Yeah.
What do you think might have happened if you didn't get her out of there?
I don't think Mum would be here.
I might even have a drink.
Anthony Bowe's mother Pat also recovered. She's yet to discover just which of her friends have survived.
How many of your friends have died because of the virus?
I'm not sure. That's something I've got to face when I get out of my room. But I've heard, I think it's about 6. It's sad, but there's worse things than death. You come in here for a couple of days, there's worse things than death.
We're working with them with an intensity to assist them.
In a webinar with families, the Aged Care Quality and Safety Commissioner, Janet Anderson, defended Newmarch House.
There has been no profound failure here. And I'll say that to anyone who asks. There has been no profound failure here at any step of this, along the journey. There has been no profound failure in the way in which Newmarch House has sought to manage this outbreak. Quite clearly, there have been struggles, there have been difficulties. Otherwise, I would have stepped back and not done a thing. Instead of which, I've been there from day one.
Commissioner Anderson did not ever attend the nursing home during the crisis.
From the outset,
Ms Anderson told Four Corners she was unavailable for an interview.
She said there was nothing that she had seen at all that would require her, or she felt there was any need to act, that she was more than happy with how things had been handled.
And what did you think of that?
I just wondered why they brought somebody in then, if that was the case. It just seemed contradictory, really.
There's no doubt that there will be an inquiry. The Royal
Anglicare Sydney CEO Grant Millard also declined to be interviewed, and the organisation wouldn't answer any of our questions. Mr Millard has since conceded the outbreak could have been handled differently.
I think, personally, being armed with more information, I might have pushed for a different approach. That might not be right. An inquiry might say, no, Grant, what you did was exactly right. I don't know. I'm just saying where I am at the moment.
Mr Millard went further on ABC Radio.
Look, if I had the time again, I'd be insisting that people who are COVID positive did go to hospital. And that's not
So that would have been the safest place for them then, that you're conceding that?
In hindsight, that would have been my preference if they went to hospital, yes.
The Federal Minister for Aged Care, Richard Colbeck, and the New South Wales Minister for Health, Brad Hazzard, also declined to be interviewed. The New South Wales coroner is now investigating the deaths at Newmarch House. The ongoing Royal Commission into Aged Care will also inquire into Newmarch, but says its purpose is not to apportion blame.
There's no doubt that this will be subject to significant investigation. And in terms of the blame issue, very importantly, in the Royal Commission notice about that inquiry, it said this will not be to assign fault or attribute blame.
I want someone to be accountable. I want someone to actually acknowledge that what they did, whether it was Department of Health or Anglicare, was not okay. And 19 people have passed away. This virus spread like the plague in there.
Almost 1/5 of Australia's deaths from COVID-19 were from Newmarch House alone. Of the 19 people who died, only one died in hospital. Now families want to know if their loved ones died to keep the rest of us safe.
And I think the fear of coronavirus, I think everyone's so scared. I think they're worried it was going to get in, and then I think it was, we're worried it's going to get out. And I think they lost sight of the need of human connection, that human touch.
I'm 100% positive that if this happened to young people, we would have had a whole different outcome. There would be people screaming in the streets if anything happened like what happened at Newmarch.
There needs to be a full-blown investigation of what went wrong for future learnings. It's a little too late for us, but we want answers, and I know that all of the families, we will not stop until we get answers. And you can mark my words.